Let's get started up again. Thank you for your patience, everyone. Next item on the agenda, 7.2, is the delegation. Jessica Colasanto, CATHET Community Action Team, and Dr. Kakatla, Medical Health Officer, Vancouver Coastal Health, regarding information provided in advance of International Overdose Awareness Day on August 31st, 2026. Welcome up, Jessica.
Thank you very much.
Just to, delegations have 5 minutes. I'll give you a warning, and if you need to go over, then I will ask for council's consent to continue, but we aim for 5 minutes.
Perfect.
Thank you.
And we do have a slideshow. Is that?
Great. Super. Slides are up.
Thank you so much.
Here we go.
Hi, everybody. My name is Jessica Colasanto. I am here as a representative of the CATHET Community Action Team, and I am joined by Dr. Kakatla, who will also introduce herself, but is a member, an active member of our local CAT. And we are here to talk about International Overdose Awareness Day that is coming up on the 31st. Over to Dr. Kakatla.
Thank you so much, Jessica, and good afternoon to the committee. As mentioned, my name is Dr. Kakatla, Medical Health Officer with Vancouver Coastal Health, and I'm honored to join you remotely today from the traditional territories of Squamish Nation here on the Lower Sunshine Coast. And Jessica and I are going to take this opportunity as we look forward 2 weeks from now to marking International Overdose Awareness Day to really take a moment as a community to reflect how unregulated drug deaths have impacted this community, and we're going to highlight through the topics highlighted on this slide just some key messages. Next slide, please, Jessica. We'll start by grounding ourselves in the data quickly, and what you see on the slide here is coroner data that focuses on overdose drug deaths within the Vancouver Coastal Health region specifically, and it's broken down by local health area. The table on the left shows absolute numbers by year, and on the right, those numbers have been shown as rates per 100,000, just a different way of showing the data to help us compare with communities of different sizes. And as you can see, and this is not news to you as a community, that over time, the community has experienced significant overdose drug deaths driven by an increasingly toxic and unpredictable drug supply that's been contaminated mainly by fentanyl and other drugs. And those deaths have fluctuated by year. And as you can see, the peak number there in 2021, where there were 17 people who lost their lives. And that peak coincided with toxicity within the drug supply, but also some disruptions in terms of services and access as a result of the COVID-19 pandemic. And over time, several interventions have been implemented in the community, including overdose prevention sites, harm reduction, treatment services that have been expanded. And so we're starting to see a downward trend that we're hoping is going to be sustained, and not just within BC, but in other jurisdictions in Canada as well. I also like to reflect as we talk about numbers that each number represents a person, and each death results in significant loss to communities and families, including yours. Next slide, please, Jessica. And this slide just highlights that as we're cautiously optimistic about the decreasing numbers of deaths, that we still remain in an emergency situation of public health significance here within BC, and that the response continues to be a priority for us as a health authority. And that response includes a range of services that are timely and that can be easily accessed by people within the community. And so I included these 2 resources here that can easily be scanned that show the range of services that are available within the community, and also a reminder about some of the basic steps that people can take both at an individual level for those using substances, as well as to support those around them using substances. And those services have been undergone quite an expansion within the Powell River area as well. And a lot of capacity building has gone into that process. Next slide, please. And then before I hand over to you, Jessica, I just wanted to highlight the importance that overdose prevention sites have played and continue to play in terms of saving lives and of being of broader benefit to communities. They have been critical, including within the community of Powell River and area, and continue to be an evidence-based approach that we support, supported by community operators such as LIFT. The local overdose prevention site that's currently in the community that's temporarily located at Brownette site also serves as a hub that connects people to treatment and recovery services through dedicated resources. And they also have broader impacts in terms of reducing public drug use and reducing equipment lying around the community and those types of things. And we know that they have other benefits, including reduction of sort of crime and drug use within communities. I'll hand over to you in the remaining minutes, Jessica.
Yeah, just looking at the time, do you need like 1 minute, 2 minutes?
1 minute.
1 minute, great. Is council consent to do that? I see thumbs up. Okay, continue.
Great. I just wanted to point to this slide, and the theme of this year's IODE, International Overdose Awareness Day, is 25 years on, 25 years still needed. And the complexities of the paths that lead people to homelessness and addiction, which have over time become so intertwined, it's a web. It is a literal web. There is no one path in and there is no one path out. And I want to call attention to the housing continuum, which is so very important. And you can see on the left, it starts with the unhoused, the unsheltered homeless, moves into emergency shelters. We were without a shelter for a year. Transitional housing, we have very, very, very limited transitional housing in town. Supportive housing, our one supportive housing building currently has a 4-year wait on average to get in. Subsidized housing, there's again, very little. Affordable housing is not all that affordable, but that's what's considered affordable before you actually get to market rental. And the idea of the continuum is that it's very difficult to move one way or the other on the continuum. More like to hop over one, typically the journey would slide one by one by one. When we're missing significant gaps in that continuum, it makes it very hard. And when someone goes to treatment and they are unhoused, they cannot come out and be expected to move right into market rental housing. It's virtually impossible. So with those gaps, we're seeing the ramifications of that. And then quickly, just the 4 pillars, but I think most people are aware of the 4 pillars. We need treatment. We need more treatment, affordable treatment centers, but we need housing for folks to come home to. And of course, harm reduction is a very significant part of this process. It's not an either or. And join us on the 31st in the front lawn for a flag raising. Thank you.
Thank you so much. I know it's in council's calendar, and I know a number of us have replied that we'll be attending. So I look to see a number of members of council there on August 31st at 10 a.m. for flag raising. Thank you so much. Any questions or thoughts from council? Councillor Elliott.
Thank you, Chair. First of all, I really wanted to say how honored I am that you've joined us, Dr. Kakatla. It's great when you come to council and talk to us and you have the science and the numbers. One of the questions I maybe had for both you and Jessica, whom I also appreciate you being here today, is given the response we've had in our community and our community groups and our community action team and the team that has been working on this crisis over the last number of years, versus communities that maybe didn't organize the same way we did. Can you say what positive outcomes that you see coming from those efforts, and whether there's some things we could organize as a community that might improve those outcomes? Thank you.
Dr. Kakatla, do you want to respond first?
You can go ahead, Jessica, and I'll add on. Thank you.
I did say I would do some of the more local questions. I would say We most likely came out ahead in the early years. We had a jump on things. There was one winter when we had no unhoused folks for a very brief 2 months, I think that happened. And then COVID hit, right? So, and I also, to tie into that, want to just point out, like, I was reflecting on all of the deaths. 95, that's a very big number for a small town. One of the reasons we don't publish the statistics monthly is because you could correlate deaths to obituaries in the paper, right? We try to respect folks' privacy. That's why we tend to get the numbers at the end of the year. And I was reflecting on those 95 and the folks that I knew personally. And what jumped out at me was that there are folks from about 4 years ago who were walking alongside death and using our services, sometimes staying at the shelter, sometimes not. Some of those folks are tooling around town now totally well, living their best lives. And in the moment then, there was no way to say, you're going to make it, you're not going to make it, you're going to make it. It is so random. The web of the path leading into this crisis is so deep that it takes many, many different opportunities to get out. Harm reduction is here so that we make sure that those pathways are available for folks. I think I answered your question.
Thank you, Jessica.
Yeah.
Any other comments or questions? Oh, Dr. Keketla.
If I could just add 2 comments. I think in the time that I have been, I've had the privilege of working with this community, I have seen, I mean, we deal with a lot of data, and we can see the dramatic and significant improvement that we've seen over time. Several years ago, there was a point in time when the community of Powell River and area was the rate was so high that we were for the size of the community, within VCH, that we're second only to the downtown east side. That is quite remarkable, and to see all the effort that went, and it's not just a health response, it's a community response that has over time, in addition to the other factors, resulted in the reduction that we're now seeing, that we're hoping will be sustained, is quite remarkable. The other aspect that's important as well, and again, because sometimes we're limited in how much we're able to publicly share the information, we know that we've had a lot more people, diagnosed. We know that we've had a lot more people connected to care and retained in care. We've done a lot of work within Vancouver Coastal Health in terms of tracking this information to be able to demonstrate the attachment that we're able to provide and care that we're able to provide to people. That's really been a good progress. And then I think also, as an outsider and not living within the community, but being there several times, for me personally, and this is something that's not easy to capture when we look at the data, is to be able to see community pull together, particularly when we're working as rural and remote communities with very limited resources, to be able to pull together, make things happen, to support people who are, as Jessica mentioned, struggling with homelessness and unstable housing, because we know how important that is as an underlying determinant of health. That is just one example that I think has really made a difference within the community, which you should be proud of.
Thank you. Other questions or comments from Council? Mayor Wasno.
It's interesting that there have been 95 deaths here in Powell River itself. And when I look at the presentation, it looks like the main emphasis is at the end of the story and not at the beginning of the story. So the story is, why are there no barriers to dealing toxic drugs? Have you or any of your organizations advocated with our Member of Parliament and the appropriate people in Ottawa to bring more realistic penalties for people that are killing our young people and old people with toxic drugs?
I would answer that by saying the statistics that I see are showing that the actual crime is happening at a much higher level than locally. And the more we restrict, the more law enforcement restrictions we put on the drug crisis, the more toxic the drug supply becomes. In other words, they're looking for the smallest amount, that like what is the most potent thing that's the smallest amount. So organized crime is involved somewhere, not on the local level, I don't believe. We're just seeing the tail end of what happens when the bigger picture of that crime is not addressed.
Thank you.
Any follow-up, Dr. Kaketla?
The quick comment that I'll make, because I think it would take a lot of time for me to get into this discussion. I think it's a complex issue, as was shown in terms of what the underlying factors are that then interact with a toxic drug supply, which is why the second last slide that was shown, that shows all the different pillars that need to go into response, including the last one, which depicted the disruption of production, distribution of unregulated drugs is one aspect of it. But again, it takes a lot more complex efforts that need to come together to be able to address the overall issue.
Thank you. Councillor Doubt.
Yeah, thank you for coming and all the information you've provided. It's always a way to learn something new that I hadn't thought of or understood before. It's nice to see the number of fatalities locally going down over time, but it's still too many. And one of the things you mentioned earlier was that local supportive housing has got about a 4-month waiting list.
4 years.
4 years. Okay. I was going to ask for some more information on that and where the people are going when they leave, because obviously unless somebody leaves the supportive housing, you're not going to have a vacancy. So is there anything you can tell me about how?
Turnover rate, for sure.
Pardon me?
It is a low turnover rate for sure.
Yeah. Okay. Is there any way it could be made quicker? Is there something that could be done to make it possible for people to leave supportive housing earlier?
I think filling in those gaps on that housing continuum, like having more rent controlled housing made available. We don't have a co-op, right? Like for anyone, it's how renting a place is very expensive for anyone. And so I think the government in '93, the federal government stopped supporting co-ops and that kind of affordability, mandated affordable housing. So that would be my answer.
Thank you.
Councillor Southcott.
Thank you, Chair, and very much appreciate you both, Dr. Kaketla and Jessica, and all the work you've done for many years, which I've been watching from a different perspective in earlier years, going way back to when I worked as a paramedic in Vancouver, and the provincial government was considering sending representatives to Germany, where the values, the community values, if you will, of values that were being, that were influencing the system they have there are very different than here. So it's really high level decisions and not just political, but social values that result in the situation that we're in right now. That's what I see. Some of us were going to go over there and actually look at what they did because of the success that was seen. Anyway, and no system is perfect. Obviously, housing is an issue here. I think we all are pretty aware of that. Given that housing is compromised, my question is, I have seen an evolution over many years of understanding of the actual situation we're in, which is basically mitigating the effects of well, increasingly toxic drugs and challenging social situations for people, including stress, like psychologically, that across society. It's pretty clear to me why people resort to self-medication, et cetera, and the choices are pretty bad. Can you speak to the interventions specifically that are available to try to help? I mean, obviously, harm reduction is part of it. But I know through our community, there's a deep yearning for opportunity for recovery. And we've spent, this community has spent a lot of money through community forest money on MCLAT, for example, which is something absolutely wonderful. It wasn't here all that long ago, because the kind of services that are in the Sunshine Treatment Center, for example, Sunshine Coast, are out of reach for most of our community. But even MCLAT is limited and expanding slowly. Can you speak to what is happening in this community more recently that serves to help people take those steps? And I'm expecting housing really is a critical factor in that towards actual recovery, whatever that is for us.
Right, I'll start. Did you want to add something?
No,
Okay.
I'm chair, so
I would say if we could magically replicate MCLAT times 10 would be amazing. We are so fortunate to have them here, but as you say, they're small. It's difficult for them to grow. We know that when people leave treatment, there is a 2-week period after treatment where their risk of overdose spikes really high, which says to me that treatment doesn't work all the time, every time. So people will go through treatment, come out, they might use substances again. We all understand if you come out and you have nowhere to go, you're going to go right back to where you were. It's just human nature. And so that's why the housing piece is so crucial in all of this. We would love more treatment centers like MCLAT that are affordable, easy access. The other problem we have locally is that detox beds don't always line up with treatment beds. So somebody can say, I am ready. We have a recovery navigator positioned, like a positioned person at the OPS to work with folks. So somebody can be like, I am ready. Well, first they might have to wait for a detox bed. And then we have to make sure that that lines up with the recovery bed, which it's most likely not going to be here. That's very difficult. They'll only hold those for a couple of days at most. So.
Jessica, I can add as well. We've heard very clearly from the community that people want services that are close to home so that they don't have to travel outside of community to access the services. And over the past several years, Vancouver Coastal Health has prioritized that request and has really scaled up in terms of the availability of services within the community. Jessica mentioned withdrawal beds, which is one example of treatment that's available right now within the Cathet General Hospital. And again, access to those beds is dependent on kind of the level of urgency based on the patient's needs. And so people, actually the wait time for those beds is not that long right now, and people are able to get in. There's been staffing, recruitment into those specific skilled positions that are required, including physicians who are able to provide the appropriate level of care. So that's just one example. So we have a range of services from inpatient to, again, transition to recovery supports, but we know it's not enough for the level of need within the community, and we're constantly working towards that. So if there aren't services within the community available for the timeline that somebody's ready to get into recovery or treatment services for, then we work with other areas within the health authority. That's not ideal, but we are prioritizing. The other aspect of it that our mental health and substance use and our regional addiction team are continually striving is this notion that we need to be able to meet people where they are at any time, and that there shouldn't be a complicated referral process. And that certainly has come into operation very well, in that people can be referred by their primary care provider or other provider. They can self-refer. They can just call one line and be able to intake line and be able to direct it to the appropriate service as needed without having to go through many different avenues. And if that doesn't work well, we're open to getting feedback around that. We know it's not a perfect system, But I'm certainly have been very impressed in terms of the capacity building, including a lot of recruitment more recently of healthcare workers into skilled positions, including counseling services, physician, nurse practitioner type services, all of those things that all come together to work. And that's separate from sort of the other community-based services that include harm reduction and overdose prevention sites.
Thank you. Councillor Palm.
Very encouraging. Thank you.
Yeah, thank you. Through the chair, I want to thank both of you for being here and sharing those statistics that are not in any way, shape, form pleasant to look at over the past 10 years. And we can certainly see the increase in deaths during COVID, people living in isolation. And, you know, they've gone down, the stats have gone down a little bit post-COVID, but still we're dealing with what seems to be more influx of individuals in need of care on the illicit drug market. Our community is being greatly affected. This is one of the top issues that politicians are going to be facing the upcoming election. There's no doubt in my mind that that will be one of the top 3 issues we're dealing with here locally. The concern of citizens out there is great. And in my visits to encampments in and around our complex and behind our overnight facilities, what I have gleaned is that there are 3 pockets of individuals that have a hard time being under the same roof. Those that are simply homeless and not using, those that are using, and lastly, those that want treatment. Putting them all in the same facility doesn't lead to the best results, in my opinion. We hear that time and time again. So I'm hoping Coastal Health is listening and the government is listening, and we need to do better in that result to curb this epidemic that we're facing in the city of Powell River alone, never mind the lower mainland. I've reached out to other individuals in various communities nearby, and they are having success because they relocated their supportive housing outside of the city core, which has had a detrimental effect on our business core here in Powell River. And they've also got good providers, as what they tell me, that are doing a great job abiding by the rules of their contract that is in place. I can't say that maybe that's happening here, but we need to tighten things up. And I'm hoping Coastal Health is actually considering reaching out and opening the door to other service providers locally that may be able to come in and operate to a higher degree. Competition is a good thing in my world, and I'm hoping that that would be a result. But again, I thank you for sharing this information, because this is not readily available to elected officials or the public for that matter. And any information that we can get in this regard and work with you to provide better service is a blessing in my world, and hopefully things will get better. Thank you very much for being here today.
Wasn't a question there, just a comment, so we'll carry on. I don't see any other hands raised. I just wanted to thank you for coming. I know that oftentimes we seek, best practice. We look to other communities. We want to find out what's possible, what's happening, how other communities are solving some of the overdose crises issues that we're facing. And what I've learned in attending all the learning sessions that I've been to in this role is that, as you showed in that map, there's no one solution that will meet everyone's needs, that will work for everyone all the time. And so everyone's doing the best they can with the resources that they have. I know that in many circles, our community is actually held up as a very great example, the community action team, and how active they are, the collaboration that exists, the attendance of peers and members from many, I know, council members here who come to these meetings to make sure that they're learning and up to date on all the facts. It's a highly looked after, or not listen, it's a highly, brain fog. People look highly upon the CAT here. And so I appreciate the members of CAT that I see here today and the work that they put into that. And so I wanted to honor that. My question for the two of you is, regarding some facts around who, obviously people of all kinds are impacted by overdoses and addiction. And my understanding is that a very large proportion of overdoses happen in people's private homes, so not where we think they do. People see maybe street drug use or OPS drug use, but my understanding is that most happen in private homes, and a major proportion of the population that's impacted by addiction overdoses are men who work or previously worked in trades. And I'm wondering if that's still true. How can you tell us a little bit more to as a part of putting a human face on the where this is often happening, and reducing some of the stigma. I know I've seen people in this room who I know their children have passed away because of overdose, and they don't share that because of the stigma. They don't want people, other members of their community, knowing that private grief. So I don't know if you could speak to a little bit about, is it still accurate what I've heard in the past about where overdoses are happening and who's impacted? Obviously, it's across the spectrum, but are there some core populations that are most highly impacted?
As of the end of 2025, absolutely. So we're kind of in the middle of the year. I don't think we'll see the full picture until the end of the year. Mm-hmm. Yes, definitely the working men in the trades, like the 20 to 50-year-old age group, and then also first-time partiers or early partiers who, unfortunately don't get their drugs tested, or so those are still targeted populations that we really, really want to help and support. And as you mentioned the word stigma, we get so bogged down in this, in the stigma. That's why we say stigma kills, because the vision that people have of the people we're talking about are the unhoused and, the folks that we see using substances on the street. Those folks are actually taking care of each other. They come to the OPS, they're being cared for, they are in touch with nurses, they are in touch with support teams. It is the folks that are using at home that are the hardest to reach. And it is the stigma around all the conversation and the negativity. I would say we are doing a great job. I think we have really great relationships with folks. They are honest with us. They come to us when they need help. I think we're doing a great job. Is there more that could be done? Absolutely. So much more could be done. But we are a leader in the province, and people recognize that around the province. So,
we've had a pretty. Dr. Kaketla?
I could add two more things to that. Thank you, Jessica. I think you brought up an important point around stigma, where people's perception might be of certain populations or specific types of people who are impacted. But again, these types of deaths can impact anybody, from people who have substance use disorder and diagnosed conditions to people who are just experimenting and are not regular drug users. The other thing too that I wanted to highlight was that men are impacted mostly, but as you may have seen from the Chief Medical Health Officer's report for Vancouver Coastal Health that came out a few months ago, is that we do have women also, particularly women of childbearing age, who are impacted and who are very vulnerable, including within periods of pregnancy or that perinatal period and early postpartum period. And so this really is a reminder that, again, communities are different and impacted differently, but also the picture of who we have as people who are impacted by overdose drug deaths. This is a reminder that it could be anybody, and anybody of us could be impacted by these types of deaths. So this is why it's so important for us as a community to come together, and this is why the community action team, and you're right, that is held in high regard as an example across even within VCH. I certainly share examples of the work that is made possible by bringing all those different partners together at that platform. And we've been able to share this type of data, be able to have discussions about it, to be able to say, okay, what's next? Who do we need to be targeting? Who do we need to bring closer to be able to continue working on getting to that zero deaths related to drug use?
Thank you. So we've all had a chance to go around once. We've had quite a bit of discussion on this topic. I'm going to check for council consent to continue on with questions and comments. I do not see full council consent, so I did not see full council.
Could we, hands up?
Yeah, I'm looking for council consent to continue the conversation. I don't see full council consent, so I will thank you very much for your presentation, and thank you very much for coming here today.
Thanks so much.